13 are female, and the range of age is between the years of 18 and 75 years old.
While you're still at the podium, Administrator. The person that was tested positive on the American Airlines flight New York City on the 14th, the Premier Center acquitted case was tested on March 28th, and this person arrived before the government urged air travelers to self-quarantine on March 15th, or legally required to quarantine on the 17th. Does that mean that this person was then out in the community for a bit before they were tested?
Well, the epidemiology, this actually was discussed earlier today with respect to the epidemiology and surveillance unit, and this particular individual did return to Bermuda. They became having symptoms a few days after their return, and then, which is why you would see that the test was taken several days after they had returned to Bermuda. But they had actually basically remained within their house anyway, notwithstanding that there was no mandatory legislative quarantine requirement, that they've just remained isolated in their own home in any event.
Yeah, so this person in that case did the right thing.
Absolutely, absolutely.
The BBC understands that there's a shortage of PPE worldwide. Can the community be enlisted to help in this matter at all by making masks, or is that not necessary?
Well, I can say, as you've rightly said, there is a shortage worldwide, but there have been quite an abundance of supplies that have been sourced, both in the United States as well as in Europe. We are anticipating a shipment to arrive on, initially it was scheduled for the 5th, but we've been made to understand that the plane is leaving a day late from China, and it's coming direct to Bermuda, and it will have quite a substantial amount of PPE on it. We are also anticipating the BA flight next week from the Crown Agents, also having further PPE. I believe that's scheduled to arrive on the 6th of April, and we also have supplies coming through DHL also on the 6th of April.
Okay, thank you.
You're welcome.
If I may, just to add to that, because I think that it's an important point of which you asked. PPE, which is required in hospital settings, cannot be made by persons at home. And we've seen the situations of where persons have been seeing these things online and all the rest. And that's in emergency situations where, unfortunately, we have doctors overseas who are having to manufacture face masks from recycled bottles because they don't have any. We're fortunate not to have that shortage here in Bermuda, and that is part of the reason why we have to make sure that we implement this shelter in place so there is not any possible community spread that gets us to a point that we run out of PPE prior to the shipments coming in. I must pay tribute to the Ministry of Health and all those persons who have actually worked to try to source these particular items today. There was a suggestion from a member of the public who suggested that we could help ourselves by producing our own face masks. Now, the key point, this is not for healthcare work, such as old bed sheets, pillowcases, and t-shirts, as long as they are 100% cotton. They've also circulated a how-to video, which will be circulated on social media to get the ball rolling, and this idea can be turned into a loose competition, who can make the most creative mask. This effort could go a long way back to bringing families back to basics, getting our seniors involved with their families, and most have had experience in sewing. Most importantly, it gets the community involved in doing something productive to help ourselves during these uncharted waters. This was a conversation that I held with
the plan is to have the shelter at Berkeley 24/7. We are excited to see our community come together. We have psychiatric nurses that were there. We have security detail that is there. We had members of the St. John's ambulance were there. We also had a medical doctor there. And so we see a safe environment where we have it, where people can come. We believe that it will be open during the period of the community protection plan for members of our vulnerable members in our community.
Just one final question about the going to the nearest grocery store, because I know some people get very technical. It's like the right next one, the one that's in your parish.
So we don't want people to overly complicate this. Okay. We do not want a mad rush and indisciplined behavior at our grocery stores. To make this easier, we believe it's simply to give people guidelines. If you live in the West, go to a grocery store in the West. If you live in the central parishes, go to a grocery store in the central parishes. If you live in the east, go to a grocery store in the eastern parishes. Do not make it any more complicated than that.
Thank you very much.
Students and parents next week. What's the process? A continuation of how they've been doing all this time?
Absolutely. The Minister of Education may give a further update to that, but given this has happened, schools clearly will not open next week, and as it was indicated, the schools will remain closed. There will be consultation regarding the online learning, which is taking place, but I want to commend those teachers, even though this is a school week break, but those teachers who have been creative and have continued to deliver learning for our students in the public school system during this time.
My last question, is there any, effects of being, are you considering in consultation with the OTCs, amongst OTCs?
I will say the question is, are we consulting with other overseas territories? The answer is yes. And as I've said, we continue to work with our other overseas territories on this particular matter. The air bridge operation, which is being organized by the Foreign and Commonwealth Office, is to stop here, to stop at Cayman, and also to get persons back home to either the Turks and Caicos Islands, the British Virgin Islands, and others. So that work continues. As is the modern world, all overseas territories premiers have a WhatsApp chat group, and we engage in our WhatsApp chats and share the latest things of which are going on.
I'm glad you said that. There's an individual here that's a female that's stuck. She's from Jamaica, but supposedly she missed that last flight to go to Canada to Jamaica. As a matter of fact, she couldn't get on the flight because Canada didn't allow her coming through. She's stuck here in Bermuda. Are you aware of the situation?
I'm not aware of the situation, but I'm sure there's many situations. And what I would say is for those persons to contact the appropriate authorities. The fact is that the airport is closed, and it is unfortunate. But I can tell you that that person is not the only person in the world that is stranded. There are many people that are stranded. This is a challenge. We don't have pandemics very often, global pandemics on this scale. The last one happened 102 years ago. We are in uncharted territories. And I know that the decisions of which the government has made to this point in time have been difficult, but it is important, I think, that we respect the advice, respect the science. I did tell the Chief Medical Officer before this that if there were no specific questions for her, that I'm going to ask her to make a few comments. So Chief Medical Officer, the microphone is yours. And I just would like to say that this woman has put a fine work and effort into making sure that the public health team is being led, and she deserves the entire country's gratitude as she works the twilight of her career. And she has been a voice of calm, a voice of reason, and someone who has continued to dictate the science to the Cabinet Bermuda.
Thank you, Premier. Well, I feel very touched by those words, but I have to confess, these decisions are not solely the decisions of the Chief Medical Officer. I have been very much supported by a team of very experienced and I would say extremely academic public health professionals, both in the Ministry of Health and throughout the community, because public health is really a very collaborative undertaking. And the Premier has done an excellent job, I think, of presenting the rationale for what is going to be a very difficult time. 14 days of sheltering at home is not something most of us have any experience in, but I think it's important to reassure the public that the decision was not taken lightly, and that it is not a unilateral decision, but is supported both by local public health experts as well as the international advisors that we have, who give us a perspective on what is the best way to suppress the spread of COVID-19 in the community now. So the goal of all of these very severe measures is to stop person-to-person spread. There is a rationale behind the sacrifice that we're asking people to make. And so it is important that compliance is at the highest level. This is not a situation that we want to do in a halfway way. It requires a lot of sacrifice, and we want it to be meaningful. We want the outcome to be that the virus has been suppressed within our community for the period of time that we have been sheltering in place, so that we can get all aspects of prevention and control at its highest level, including testing capability at its highest level. And I think that if we all cooperate, if there's a large amount of compliance and honesty and solidarity, this period of hardship will be well worth it. So that's all I have to say, unless there are other questions.
What's the best thing that you can say to the Bermudian people to make sure that this is only a 2-week period that we have to quarantine?
Well, in life and in public health, there are no guarantees ever. But the best advice I can say is that we look to other countries' experience over the last few months, and it appears very clear that the incubation period of the virus is 14 days maximum, and that while there are definitely asymptomatic carriers, people who don't get very sick or have very mild illness, the purpose is, if we can shelter in place, even those cases will subside, and we will not have individuals becoming unwell to a great extent. The other big part of making sure that this is effective is to really protect those who are most vulnerable, people who have pre-existing medical conditions or who are over the age of 60. Those individuals are more likely to become quite ill, and it is the goal of this suppression activity, this community protection action that is being taken to avoid that, to avoid people getting very sick. And that is the end game, really. This is a pandemic, so ultimately the virus will be quite widespread, but 80% of people will not have a significant consequence, will not be in hospital. And so our goal in this 14 days is to make sure that we optimize the chances that we will have the virus suppressed sufficiently, that those who are most vulnerable won't end up being in hospital and certainly won't be in intensive care. So it's a modest goal, but that is the reality in a pandemic.
Any other questions? Thank you. Other questions?
In closing, I just want to reiterate the message of which was put out regarding the shelter in place. The Ministry of Health will be issuing guidelines, but this means that all activity as of Saturday at 6 a.m. must cease. It is difficult to shut down construction. It is difficult to shut down all these other items which make the economy work. But as it has been said, it is essential at this point in time to make our best efforts to save lives. And that is important. So I want to thank all of those persons and the public officers who stepped up to the plate, the public officers who are providing childcare services to our essential workers, which will continue, all those persons who are doing what is necessary and proper. The final thing is that the curfew exemption request has not changed, and people can access that form at coronavirus.gov.bm. The website is right here. There is a link to that particular form there, and you can go ahead and make your requests to be exempted from to have permission to travel during the shelter in place if you have special circumstances. But so we are clear, persons outside of the areas which have been outlined by the Minister of National Security will most likely not be considered. The objective of shelter in place is for minimal movement to allow our public health system to make sure that we can catch, contain, and control the future spread of this particular virus. I thank persons for their patience. I thank persons for their attention. I ask you to look out for the official guidance, which will be coming out tonight and over tomorrow, so you can understand. Do not rush. Do not panic. You have time to prepare. But once Saturday morning comes, let us all be inside of this together. It is incredibly important. Remember, it is a difficult time emotionally for many. So give that call to your friends, check in with them, and let's make sure as a community we can endure these next few weeks in a sense of unity and a sense of purpose, recognizing that we're